What's up, guys? It's Dr. Adam. All right, so number one on our mentorship checklist is going to be medical. Unfortunately, most people define mentorship strictly based upon medical. They look at mentorship as how much can they teach me of all this knowledge I learned in vet school. The reality is the medical part makes up only a small part. I'll be completely honest. I usually tell my mentees, pretty much everything you learned in vet school, we're going to teach that probably in your first year. But of course, any good mentor is going to help any mentee refine their medical, their surgical skills, kind of teach you all the traits we've learned over the years. But a real effective mentor is going to take that mentee and relay to them, you have everything in your head. I'm just going to show you how to put that into a digestible form for the owner. So I'm going to give you a great example here, guys. Let's take Cushing's, for example. Everybody knows Cushing's and you've studied everything about it, but all that medical knowledge, how do you relay that to the owner? And from a mentor, how do you take that mentee that's got it all up there and put that in an organized manner? So there's two ways we can approach this, right? You can come into a room and you can say, okay, your dog has hyperadrenal corticolism, you had a high alk phos, you have hepatomegaly, we did an ACTH stem, low-dose dex, we're going to start a drug. That's a lot of big terms, guys. And you're right. If you go by the book, all that stuff's accurate. But that owner's probably walking away going, what just happened here? That vet just spewed a whole bunch of nonsense to me and it doesn't make any sense. As opposed to the mentor taking the mentee aside and saying, okay, let's put this from the owner's perspective. Why don't we go in the room and start very simple. Okay, let's go back to what brought you in today. Your dog was drinking a lot at home. Your dog was peeing a lot. Your dog was panting a lot. So what we did some basic blood work just to kind of rule out some common causes for that, being that your dog's a little bit older. And what we did is we saw one of the liver values, more specifically the alkaline phosphatase, was a little bit high. And when we see that value high, that makes us suspect a couple diseases. But in this case, because on the physical exam, we saw that pot-bellied appearance, and you can show them. We have the history of drinking, peeing, a lot of panting, the appetite's up. That makes us suspect a disease where the cortisol or steroid levels are high in the body. So have you ever taken steroids at home, like prednisone or anything? And if they have, okay, these are some of the symptoms you've seen. But just like a dog taking a lot of steroids, this is a disease where the body produces a lot. And as a result, you're going to see drinking a lot, peeing a lot, panting a lot. We're going to see that starts to take an effect on the liver. So the liver may look big on x-rays. The liver value is going to go a little bit high. It's going to thin out their body wall, so we see a pot-bellied appearance. So does that all make sense as far as why we're suspecting this? So now that we're suspecting it, we want to confirm this disease. So we can do two types of tests here. One is called an ACTH stem, the other one's a low-dose dex. And we can go into detail how these tests work, but the result is I want to prove this is what we have. And if we have Cushing's disease, then we want to go ahead and try to manage the disease. And then we can go on and explain trilostane or lysogen. But my point here, guys, is you really want to take all that stuff in your head and put it into a digestible form for the owner. And that's not necessarily your job. That's the mentor's job to kind of show you how to do that. So again, going back to the basics here, the medical part is going to be a fairly small part on my checklist here. I think it's very important, and any good doctor is going to need to know this and be able to create a good differential this. But the important take-home message here is don't focus primarily on this. Take a breath, calm down, and then like I said, when all's said and done, we'll go through this checklist, and as long as you hit all these checkpoints, we should be good. So hopefully that helps, guys. We'll move on to series number 2 in a sec here. All right, take care.